Hey everyone, so this is Chicago Med, Season 3, Episode 1, called Speak Your Truth. So, just a little recap of the Season 2 finale. Robin, or kind of what's been going on, like at least the last few episodes of Chicago Med, Robin had been having some mental issues, like mental symptoms, like psychosis. For one, I think it's mainly just psychosis actually, that she was dealing with. So I believe she was finally diagnosed with a tumor in the finale that caused her psychosis. Dr. Charles was dealing with an increasingly short-tempered and increase and a person who was heading towards violent tendencies named Jack Kellogg, and as everyone else is at the luau enjoying themselves, Jack shoots Dr. Charles because throughout the entire day, Charles kept he kept, I guess you could guess from his point of view, blowing him off. So and the final straw was that he went to Robin's side when he found out that she was having she had a tumor in her brain that was causing her psychosis instead of the typical the diseases that would cause psychosis, like what you call it, schizophrenia and things like that. So Rhodes is seen then performing the surgery on Charles, or going to perform the surgery on Charles. So it jumps then to a few months later. They didn't specify how much time has passed. I assume the same amount of time that has passed in real life as well. So Charles is recovering nicely, at least in the physical sense, and goes to start goes to start a Kellogg's trial over shooting him. We also learn that Natalie has just returned from a 3-month sabbatical. We don't know why, at least not until the very end, which I will get to. Natalie, or Brett, then brings in Brett from Chicago Fire, brings in Brian Cutler and his wife, who were involved in a high-speed crash. Natalie takes Brian, and Halstead takes his wife, Judith. Judith reveals that they were fighting, and because of that, he didn't see the other car. Then goes over to Reese, explaining the side effects Robin might have after the tumor removal, like hyper or super insomnia or something like that. And there's a whole bunch to shoot battle off that I didn't remember or write down. So, but there was stuff like that. So, after Reese leaves, she and Rhodes then have sex in the room. Reese then, or as she's trying to go to the trial to support Charles, April's brother, I can't remember his name, comes up and tries to offer some food, but then she reveals that she's trying to go support Charles, and he makes the comparison that Charles is like her father, and she gets upset about that, saying that the two aren't comparable since she hasn't seen her dad since she was 6. I don't I don't remember that storyline ever. So maybe if if that we heard that storyline before, but I'm just forgetting about it, please correct me in the comments. But as far as I know, we haven't heard anything about her father before. So Who knows? Anyway, so when Reese gets to the courthouse, we see Charles is on the stand testifying, and he says that his colleagues that evaluated Kellogg evaluated him long after the shooting, and they are tainted because they weren't there in the hours leading up to the shooting and the shooting itself. So Charles feels he is the only person qualified to answer that question of whether or not Kellogg is insane or not. And ultimately, he says that Kellogg is insane and should be found not guilty for reason of insanity. Outside the courthouse, Reese confronts Charles after his testimony, and he basically just defends it. Then jumps to Dr. Troy, who has the case of a teenager named Ryan who started having headaches a couple weeks prior, and now he's starting to have a raging fever. As Troy tries to give pass out orders, Ryan throws up. Rhodes and Robin get home and then have sex again. We see that. Then it goes to Halstead, where he finds out Judith Cutler is mostly fine, but has some swelling, and he is still kind of concerned that about her vocal cords because she's still sounding hoarse. She came in sounding hoarse, and she's at this point in the story, or in the episode, she's still sounding hoarse. So he wants to make sure that her vocal cords are okay. During this time, Natalie comes in and informs Judith that Brian has a brain bleed, has been moved to the ICU, and the only reason why they have moved him there is because of the fact that it can't really be solved by surgery. Reese goes then up to Goodwin to see if she knew about Charles's change in testimony, and we find out that she knew, but it was like earlier that day, and there was really nothing that she could do to stop him from doing that. Reese is upset because Kellogg should be in jail. Goodwin agrees, but then she's like, well, it's not really up to us right now or anymore, because it's now up to the jury. We then go back to Ryan, who can't breathe normally, because his left lung is full of fluid. As Troy puts in a chest tube, pus from his lungs spurts out onto the wall. So Troy has April run his labs, while he makes Doris, another nurse, clean up the pus. Doris is mad because she is stuck cleaning up she was stuck cleaning up the vomit that Ryan threw up onto the floor, and now she has to clean up the pus on the side of the wall that was spread onto the wall. And she feels like she got stuck doing that because April and Troy are sleeping together. I'll save my thoughts on that until the next scene with April and Troy that gets brought up about like where this whole sleeping together thing comes up. Dr. Latham is seen. This is the first time we've seen him in the entire episode. He has a heart patient named Wilson, who is in heart failure, and so they're tasked with finding him a new heart. Dr. Becker, colleague in the, I guess, fellowship for cardiothoracic surgery with Rhodes, takes or manipulates Latham into giving Rhodes' surgery to her under the guise that he has it on his plate. So what she does, she gets it. It then goes immediately to Rhodes, who is trying to make his way to the hospital to do the surgery that he, as of yet, doesn't know was taken from him. And as he's trying to do that, Robin tries to have sex with him yet again, this time on the kitchen or the dining room table. But he leaves anyway. She senses that something is wrong, but he's like, he doesn't say there's anything wrong, even though his face is given and is a dead giveaway. Um, excuse me. So it goes back to the hospital where Dr. Stoll, who earlier discharged the patient due to the fact that he was pretty much patched up and he didn't need to be there anymore, is back again because he was shot by some, I guess, gang member. I don't want to say gang members, but some people who, for some reason or another, have it out for him. And if he goes back to his house where nobody's there to watch over him and to protect him from getting shot again, and so he's back at the hospital. So in the hospital parking lot, Rose asks Reese about the symptoms again, and he finds out that hypersexuality is one of the symptoms that she might have. And then he finds out that Becker took a surgery. Then goes to April, who shows Troy that Ryan's white blood cell count is very high. 16,000 as far as I remember. So he asks her to, do some other stuff. I don't remember what it was. But before she does, she asks him about if he told Doris about them sleeping together. He said he didn't. But she doesn't want it to get out that she is a nurse sleeping with a doctor because she feels like it's a cliche. And while she doesn't think of them like that, others would. And he's like, well, who cares? But she tells him, well, it's easy for him to say, who cares? Because he's the doctor. I mean, there, he's not likely to let go. So, so my whole problem with this is that whether you like it or not, you have to admit that he's been giving you the easy work. At least on this case. He's been giving you the easy work, at least on this case. And giving everyone else the gross, dirty work. So, and whether Troy is doing this, unintentionally or not, this was happening. It seems like he's doing this subconsciously, where he's giving April the easy work and everyone else the grunt work when it should be spread out just as equally. It's because as far as I know, Doris is not the same. Is at the same level as April. So anyway, so Ryan then has a seizure. They get a head CT, and then goes to Brian, who, due to his brain bleed, becomes brain dead. So Latham asks Natalie and Halstead to ask his wife to donate his heart for his patient. So the pair then deliver the bad news and ask for consent to give the guy her husband's heart, which he ultimately consents to. Rhodes then confronts Becker, then gets told that he will have to do the transplant, which will be difficult since the heart will have to be reconstructed. Back at the courthouse, Charles finds out Reese is being called as a rebuttal witness. Reese gets on the stand, refutes his testimony, and then Kellogg becomes angry and violent towards her before being restrained by bailiffs, or almost violent towards her. We then find out that Ryan has a brain infection. So they're wondering how he could have gotten it, whether it's by camping, swimming, or possibly a trip to the dentist. She explains that he hasn't been swimming in the lake or camping or been camping, and they haven't gone to a dentist lately because it's expensive without insurance, and she lost a job where she had insurance. So Troy then looks in Ryan's mouth and sees a place on the left side where he could have gotten a bacteria. So they'll give him antibiotics, but they say that they will need to go, or he will need to go to an oral surgeon to get that abscess drained. Stoll sees his former patient discharged. I forgot to mention that earlier when he confronted Maggie about the whole thing, about his patient earlier. That, he was like, well, you need to treat him and treat him. And she's like, well, yeah, that works for it. Maggie was like, well, that works for people who... she's like, well, that works for people who have the money to, leave when they're all fixed. But, that doesn't work for him. And so a little later, he, sees them getting discharged, and so he ends up letting him stay by under, I guess, false pretenses and all that. Charles confronts Reese about her actions. She explains why she did it, and they get into an argument before Goodwin steps in and tells him, like, well, you know what, look, you took Reese under your wing because you liked what you saw in her, and so don't hold it against her now. And she explains, like, well, I understand you want to get back to work, and all that, but now you're championing the guy, or championing for the guy who shot you, and it concerns her because because it seems like he feels guilty for missing the signs of a killer, and he wants to get back into control. Latham talks with Rhodes and says he realizes he may have been manipulated into giving Becker Rhodes original surgery, but perhaps he got the better surgery after all. Natalie and Halstead tell Judith that her husband's heart was successfully transplanted. She reveals that the last thing that she told her husband was that she didn't love him, So she goes to visit the man who got the transplant and in a way, tells her husband that she's sorry. Charles visits Robin at the apartment, and she fears that her feelings for Rhodes are part of her disease and that they aren't really real. Halston then reveals to Natalie at the end of the episode that the reason he broke up with Nina is because he is still in love with Natalie. Natalie reveals that the reason she took the sabbatical was because of him until they kiss, and then, God, I'm so done with them. I mean, their entire relationship since episode 1 of season 1 has been annoying as hell. I could really care less about them. I could really care less. I really do not like them. I never have. This back and forth tit for tat shit is really fucking annoying as hell. And I mean, cause first she was like, Halstead, I can't be with you because my husband just died and I'm carrying his baby. And like my husband just died, I'm still emotional over that, and I'm carrying his baby, and I'm like, oh my god, which I get, I understood it. And then she's like, you know, maybe I do have feelings for him. Like, I mean, the girl's been like 3 years. Now you, like, I don't know. It's just something feel like, I just can't with people who seem to flip flop all the time. And I just can't. I mean, I really can't. So, I don't know. Anyway, so, looks like, coming up on the season, Halstead and Natalie are finally a thing, even though I don't really like it. There might be trouble with April and Troy's relationship that will cause them to be permanently split up professionally and personally. And there are difficult cases coming up soon. So that's the entire episode. What seems to be happening during the season. I didn't see exactly what happens next episode, but so I don't know. There wasn't anything specific to what's gonna come in next week's episode, so I don't know what's going on with that. But that's today's episode or last night's episode. So we'll see what happens throughout the season.